Good day. I am James Philip Ray V. Pinggolio, and I will present my research entitled The Development and Validation of Quarterlife Crisis Scale for Filipinos. Mostly, when an individual experiences transition from one stage to another, adjustments can really be difficult and may lead to crises. Developmental crises such as identity crisis for adolescents and midlife crisis for middle adults are globally known for its existence and popularity. However, for young adults, they might also experience difficulty in their stage that may lead to crises in which they do not know what it is called. In 1997, it marked the genesis of the term quarter-life crisis, a crisis which stems from difficulty in adjustment from adolescence to young adult stage, from school world to real world, which affects many 20-somethings of today. Social expectations, having no clear guidelines in navigating their 20s, and having an idealistic attitude are some of the factors of this anticipatory crisis. It affects the personal, social, career, and relationship aspects of young adults. Why a study on quarter-life crisis? There are several concerns why the study was conducted. First, there are many young adults who are experiencing this phenomenon, but many of them do not know what it is called. Second, fewer studies are being conducted on this age group. And lastly, there is lack of psychological studies regarding this phenomenon. Why scale development research on quarter-life crisis? The researcher hasn't read or sees any validated scale that will measure the quarter-life crisis of an individual so far. There's already an existing study on exploring quarter-life crisis, but there is no specific scale that will measure it yet, and few researchers conduct or focus on test development research. What are the objectives of this study? Primarily, the objective of the study is to develop a scale that will measure the quarter-life crisis among young adult Filipinos. It is divided into two main phases, the development and validation of the scale. Validity and reliability testing, as well as standardization, were done in this research. The QLCS research is a scale development research design, and its process is based from Cohen and Swerdlich. It uses a purposive sampling technique. The figure presents the process of the development and validation of quarter-life crisis scale. In the development phase, item pooling was done, and items drafted were checked by the experts for content validation. In the second phase, pilot testing, then field testing, and norming were performed. The participants of the study were 835 young adult professionals. Graduates of at least 4-year course, they are presently working in related or non-related career, rendered at least 6 months of service. Their ages range from 21 to 30, male and female, single and Filipino. The 835 respondents are divided into two, 328 respondents for initial validation and 507 respondents for final validation. Majority of them are males, mostly came from Cavite, Philippines, at least bachelor's degree and working more than 2 to 5 years. Priests, nuns, brothers, single parents are not included in the study. Also, on-the-job trainings are not considered as a work experience. For the results of the study, 165 statements were drafted and gotten from the literature. These 165 items were divided into 4 subscales, namely personal, social, career, and relationship. It was then validated by 3 subject matter experts, and 134 items remained after content validation. The 134 item scale was pilot tested to 328 respondents. The data gathered were used in calling out the items. Item total correlation, Cronbach's alpha, and exploratory factor analysis or EFA were performed. In item total correlation, values with at least 0.50 were retained, 53 items remained. In EFA, to check if the sample is adequate, the Kaiser-Meyer-Olkin test was performed. The KMO test result is 0.956, which is higher than minimum value of 0.50 required. Therefore, the sample is adequate. principal axis factoring, and Promax with Kaiser normalization rotation were used. Factors were determined by eigenvalue. In Gatman-Kaiser rule, values greater than 1 were retained. From initial 4 factors, it became 9 factors. Then 1 factor was eradicated due to few items. The 8 extracted factors were named as SC, social comparison, CC, career consolidation, PF, preoccupations and fears, IR, intimate relationships, ST, struggles in transition, WS, work satisfaction, SI, social isolation, and FD, frustrations and disappointments. 41 items were retained after the EFA. Cronbach's alpha was used to measure the internal consistency or reliability of the scale. Values interpretation were based from DeVellis and Nettemeyer, and factors within the range of 0.50 and 0.90 can be retained. In the table, it shows that factors 1 to 7 have very good interpretation, and factor 8 was respectable. The 41-item scale was then again tested. In the field testing, there were 507 respondents. Confirmatory factor analyses, or CFA, and Cronbach's alpha were then utilized. In the reliability analysis, the results showed that the values range from 0.762 to 0.878, which means that the factors fall under respectable and very good interpretation. In CFA, maximum livelihood estimation method, correlation coefficient to trace evidences of good discriminant validity, and goodness of fit were tested in 41 items, 8-factor scale. The figure shows the path diagram analysis of the QLCS. In the goodness of fit measures, the table shows an acceptable and good fit as measured by the chi-square test. In evaluating the overall fit model, root mean square error of approximation, or RMSEA, and standardized root mean square residual, or SRMR, were analyzed. Findings showed that the model met the criteria for a good and acceptable fit. RMSEA value is 0.059, which falls on the adequate range, and SRMR is 0.0495, which means that the model has a good fit. On the other hand, results of the Comparative Fit Index, or CFI, and Tucker-Lewis Index, or TLI, showed that the model can still be improved and be revalidated. The last part of the test development process is norming and standardization of the scale. In this test development research, the norming stage comprised of 507 respondents as samples. Means and standard deviations were used as statistical tools in the data to develop the norms of the QLCS. Table shows the norms for QLCS that is very helpful in the use of the scale. For the conclusion, the QLCS is intended for Filipino young adults and has 8 factors. It's a valid measure of quarter-life crisis among young adult Filipinos since it went through a rigorous process of content, construct, factorial, and discriminant validity as established by the subject matter experts, exploratory factor analysis, and confirmatory factor analysis. And it's a reliable measure of quarter-life crisis among young adult Filipinos as proven by high values obtained from Cronbach's alpha, item total correlation analysis, and went through process of standardization and norming. The QLCS can be used for assessment, counseling, and program development. It can be revalidated considering a large number of samples, adjustment of age range, and use of other construct validity measures. This can also be adopted by other cultures. To end, I would like to thank De La Salle University Dasmariñas Psychology Department and College of Liberal Arts and Communications for funding, and also International Academic Forum for accepting my research and the opportunity to present and share my knowledge. If you have queries or maybe would like to tie up for further research, you may contact me through my email jprvpinggolio@gmail.com. Thank you very much.